Bipolar disorder, also called as bipolar affective disorder or BPAD, is very commonly confused by people with day-to-day mood swings, which probably all of us experience from time to time. So let's understand exactly what this illness is. In bipolar disorder, a person experiences repeated episodes of depression and what is called as mania. Depression is something that we are in general very much aware of, where an individual for a protracted period of time, ranging from weeks to months or sometimes years, experiences a constant feeling of low and sadness of mood, decreased interest in doing day to day activities, decreased confidence, in general, a very negative outlook towards the world, towards themselves and their future, and along with this, also experience sleep and appetite related issues. On the other hand, when we talk of mania, what happens is exactly the opposite, where an individual experiences for an extended period of time a kind of a high energy levels, reduced need for sleep. For example, a person might need sleep for only a couple of hours at the night, but still feel so active that he might take up a lot of hobbies, do a lot of work, getting up early in the morning. The individuals become very talkative, and most importantly, there is a very prominent emotional high or an irritability. The individual feels so good about themselves that sometimes they might start making tall claims, such as saying that they have a lot of money or a lot of contacts, and in general sometimes even lose a touch with their reality. Because of such a high mood, an emotional high, they might end up making risky financial decisions or rash decisions with respect to the relationships and work as well. And you can imagine that a person's behavior who is experiencing such an emotional high can be unpredictable and sometimes even life threatening. It frequently starts in the teen age, and the illness can have a very long course with repeated episodes of mania or depression throughout the lifetime if untreated. When we talk about risk factors for bipolar disorder, it is polygenic, so there is no single cause, but there is a very strong component of genetic risk as well. It is seen that bipolar disorder individuals have heritability rates of 60 to 70%, meaning that in 6 or 7 out of 10 individuals, you will see that they will have a relative in their family who has also experienced bipolar disorder or some kind of mood disorder. Abnormalities in specific brain areas have also been recognized in these individuals, such as the hippocampus. Along with this, an important component of environmental risk also happens. So, for example, stress in any form can also precipitate multiple episodes of bipolar disorder in whom the disorder already exists. Along with this, there is a major component of sleep related problems as well, where it is seen that in individuals who have bipolar disorder, lack of sleep can trigger any of these episodes. So it is always recommended by a doctor that a good amount of sleep of 7 to 8 hours on a daily basis is required in these individuals. Apart from that, different drugs of abuse such as cannabis have also been known to precipitate illnesses, and along with that, alcohol, tobacco, and other drugs of abuse can also worsen an existing bipolar disorder in individuals who develop addictions to different substances. Talking about treatment, since bipolar disorder can depend on a lot of factors and sometimes become severe and life threatening, it might require admission sometimes when there is severe agitation or aggressiveness or suicidality in a patient. Medical treatment frequently involves different kind of medications such as mood stabilizers with the idea of controlling the ongoing episodes and also preventing relapses of future episodes. So it will frequently be seen that in individuals who experience two or more episodes, the doctor might advise continuing medications for a longer time so that repeated such episodes can be completely prevented. Apart from this, lifestyle modifications such as improving sleep habits, staying away from substances of abuse, and learning effective techniques to deal with stress so that repeated episodes secondary to the stress can also be prevented. And as it goes without saying, a strong support from family and friends also goes a long way.